Hello and welcome. Today's lesson is trauma informed care. This is for our youth and our young adults. I'm Dr. Yolonda Young Simmons, and I'll be your facilitator for this particular training. It's important. I made this part two from our part one because our youth and young adult is our future, and we need to address what their needs are because they are our future. We're going to discuss the principles, the practices, and the lasting impact that trauma informed care has on our youth. There's three E's that we'll talk about. The events, trauma can arise from a particular situation. That's the event. Something happened. And when you're talking to a person or youth or adult or youth, then you say, "What happened to you?" You don't blame them for acting out or acting strange. You can ask the question, "What happened?" There was an event that happened that caused the trauma. There was an experience. Everybody perceive and process traumatic events differently. And know that we're all different individuals. And so how they perceive and experience that was trauma. And the effects, trauma can have an ongoing physical and emotional effect on them and other. Those are the three E's: experience, effects, events, experience, and effect. We have to recognize that over 70% of our youth is exposed to some type of trauma. I mean, with the internet, internet trolling, internet bullying, it could create changes in their behavior that makes them traumatized. It could be ill-tempered, bad mood, withdrawal, academic problems. All of this can be based on the fact that they've been traumatized by something. So we must understand that these signs may mimic other behavior, but we must understand that we have to remain observant and watch after our youth because we have to understand that the brain of the youth is not really developed with adverse childhood experiences. At age 5, yes, they know no, don't. They understand their boundaries a little bit better at age 5, but the brain doesn't really develop until about age 25. And so trauma can alter the tie to memory, stress, learning, and social functioning at age much sooner than age 25, but it can stem from childhood experiences. But by the time they get 25, then they understand cause and effect, they understand planning, they understand consequences a little different as they mature in today's society. But we have to understand that a lot of times the trauma may hit them at a much earlier age and still be affecting them. Those three E's I talked about, it can still affect them in some form or fashion. And we have to be observant as we watch our youth, get knowledge and understanding, understand the impact of the experience that shaped their behavior, and give them safety and trust. Build an environment with partnership and other local support, where if you have to refer them for special services, then you know where to send them. Recognize the culture in trauma and in healing. It's very important that we respect the background and beliefs and practices that other people experience. Look at the picture there. You have different nationalities. You have different religious beliefs. You can tell by the way they're dressed that they're different. But we have to meet a person where they are, meet the child, the youth where they are, and provide understanding that they're operating and they get their healing based on how they operate in their culture. So understand that every culture may be different, and whatever it is, you operate within that because it's important that they get the healing. And so the key principles is that they're safe, that they feel safe, that they trust the environment that they're in. They have peer support, they have collaboration, they also have empowerment. When you give them all of this, they feel empowered. And when they feel empowered, then they can do more. And then also, we have to have cultural sensitivity, which we just talked about. When you apply these things as key principles for healing, then you can be a vessel that God can use to lead them to the support that they need so that they can get the healing they need. They don't have to stay in the mess that they are, but you must be observant. And listen to the Holy Spirit if God leads you. You don't have to be a codependent. I'm not telling you to be a codependent. No, that no, 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 no. I'm telling you to empower the person. The word empowerment, empower the youth to have the firm decisions, to understand that they're not lost, and understand that it's not a life-threatening situation that they're in. The trauma can be healed, and they can move forward in their life. They don't have to stay stuck in the trauma, but they can move forward. And that's what's important, that we give them the key principles for healing. And so there's keys to success. And those keys to success, understand that trauma impacts behavior. So don't take their behavior in a negative way, but understand it was the trauma that they're faced with. And you can give them compassion care, because that will improve the outcome to be a more successful um, result for the person that's dealing with the trauma, because everybody plays a role, and you never know where God put you in a position that you can minister to somebody that has some trauma. Maybe it's similar trauma, or maybe you know somebody who knows somebody who knows somebody, and you can refer them to get the help they need. But don't overlook the fact that they had an event that occurred for them, and that you can have compassion and care. And then you have the teddy bears with the hearts. And when you have the teddy bears with the heart, that shows love and compassion. And when you show love and compassion, and the Bible tells you the greatest commandment that God left us, that we will love our neighbor as we love ourselves. And I'm trying to encourage you to love your neighbor. Love that child that might be without a mentor or without the direction, and they're just considered a bad youth. No, give them compassion and love. That will improve the outcome. Because, as I said, the Bible said, "Love thy." The greatest commandment is to love thy neighbor as thyself. And you can show love in this particular area, because trauma affects all of our lives. It's how we deal with it. And a lot of times we can lead them to Christ. A lot of times we can lead them in prayer. It might be that you place the nugget and somebody else waters it. You just plant the seed and somebody else water it. But be aware of your environment and know that our youth need us. Don't leave them out there. I thank you so much. My name is Dr. Yolonda Simmons. Thank you for letting me service you today. God uses ordinary people to do extraordinary things. And I thank you so much, because I know that I know that I know that God will use you in a mighty way. And so take time to like and subscribe to all of my faith-based material that I have to provide for you. I would love for you to leave me a comment and give me some feedback, because my job is to service you. And that's what I want to do. Thank you for letting me share. Take care.